Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Oakton, Virginia, discussing advancements in dental implants and how they can give you a healthy and beautiful smile with one of this area's top implant dentists, Dr. Rodney Mayberry. Dr. Mayberry received his DDS degree from the Medical College of Virginia. He is a fellow with the American Academy of Implant Dentistry and is a diplomate of the American Board of Oral Implantology and Implant Dentistry. Dr. Mayberry is recognized as one of this region's top dentists. Welcome, Dr. Mayberry.
Thank you.
Oh, it's our pleasure to have you on, your first time on our program. In fact, we've got a lot to talk about. I understand there's two patients who are going to be joining us a bit later as well.
That's right.
So let's begin, if we may, I wanted to ask you to tell us what dental implants are for those of us who may not know.
Well, dental implants are basically artificial tooth roots that can be used to replace one or more missing teeth, or can be used to support removable teeth like dentures or partial dentures.
Interesting. And what problems do they correct, Dr. Mayberry?
Well, dental implants allow us essentially to have a third set of teeth if we lose our permanent teeth or our adult teeth. They can strengthen the jawbone, where many other types of dental restorations actually cause problems to the jawbone, like removable dentures will cause jawbone to be destroyed underneath the constant chewing forces. And dental implants do just the opposite of that. They help strengthen the jawbone and preserve it.
Now, who would you say, doctor, would be a good candidate who can benefit from dental implants?
Well, any patient who's missing teeth or is about to lose teeth could benefit from dental implants. It's important to try and plan for dental implants in advance of tooth loss, because that can help us make the procedure easier and preserve bone that we lose otherwise when teeth are lost.
Can you describe the process that a patient would typically experience regarding the dental implant treatment from when they contact your office? And again, I'm sure it varies based on the patient and his or her specific needs and how much work would be involved. But in general terms, just so folks have an idea of what they're looking at.
One way we help patients is when, for example, patients have a tooth that's had root canal treatment and that tooth has become reinfected or becomes a problem, which is common we see with teeth that have had previous root canal treatment. They fail more often than any other teeth. So rather than remove that tooth and wait for it to heal, we'll remove the tooth, put our implant in the same day. And that allows us to preserve the bone around the tooth, and we have a good foundation for our implant, which can be lost if we just remove the tooth and then let it heal. So once that implant is in place and healed, then we can start to build a tooth on it. Now that takes several months from the time that the tooth is removed and the implant is placed to the point where we can start to build a new tooth on that artificial tooth root, the implant that's under the gum tissue at that time.
Oh, I appreciate you letting us know that. We have a better understanding of what we're looking at. But there's nothing like getting the function back and the smile back, and certainly to know you can get an implant the same day you come in some cases is very good indeed.
Exactly.
Now, what kind of results are we looking at, Dr. Mayberry, from the dental implants?
Well, dental implants have many advantages over natural teeth. One of the primary advantages is they don't decay like a natural tooth. And so we see in our older patients, they start to develop dry mouth. Either they're on blood pressure medications or other medications that cause their mouths to become dry, and they're much more subject to tooth decay. And many of our patients have had extensive dental treatment, and they've had crowns, bridge work, root canals, and then they get decay in these teeth, which is very discouraging. So by using dental implants, we can avoid having future tooth loss because the dental implants don't decay and they're much less subject to failure than natural teeth.
Very impressive results then from what you
They're
just
excellent.
described. I understand, Dr. Mayberry, that you have some patient before and after pictures that you'd like to show us?
Yes, I do.
Let's take a look.
I have, this is an example of a patient who had previous root canal treatment and was going to lose this tooth. And this is a front tooth, shows the area, very cosmetic area, patient's very concerned, and we got an excellent result. You can see from the after picture, it's almost impossible to differentiate the tooth that's being replaced with the implant that's right next to the natural tooth.
Very impressive work, Dr. Mayberry, and what I noticed very clearly is that it looks very natural. That patient does not look like they had something done, and I think that's very important when one is getting work done. You don't want to look like you were done, in other words.
Well, that's the greatest challenge in implant dentistry, is to develop a beautiful aesthetic result along with the strength of the result, especially in the cosmetically important areas in the front of the mouth. In the back of the mouth, it's not so important because it's never seen, and we still have the strength, but we always want to try and reproduce the most beautiful result and the result with the greatest strength.
Yes, indeed, in a very natural looking manner. And I wanted to ask you, speaking of results, how long would you say these results would typically last? And again, I know sure it varies patient to patient and how much work was needed, but in general terms, doctor, what are we looking at?
Well, that's a great question. Dental implants are the most reliable, dependable, long-lasting dental restoration we do in dentistry today. We have statistics now approaching 60 years with high 90 percentile success rates. Dental implants are above all other dental restorations we do in terms of success.
Very powerful numbers there.
Yes, unbelievable.
We're now going to meet two patients of Dr. Mayberry. Welcome, Ed.
Thank you. It's nice to be here.
Oh, it's a pleasure to have you on with us, and we always appreciate it when patients take time in their busy lives to come down and share some of their experiences. And on that note, I'd like to begin by asking you, Ed, what dental problems have you experienced over the years that Dr. Mayberry has taken care of for you?
Well, my teeth had gotten in very bad shape, and Dr. Mayberry did some bone grafting, did 8 implants, and crown bridges and in the front.
Sounds pretty extensive.
It was.
Quite a bit of work over the
Yes.
years. And a lot involved in these treatments and procedures?
Well, the bone graft was especially. I didn't have enough bone in my upper jaw, so he cut that bone out of my lower jaw and put it up there.
Oh, my. And these problems were affecting your life as far as regular function,
well,
chewing?
your teeth get so bad you're ashamed to open your mouth.
Yes.
So when you feel, it makes you feel good to have your teeth in good shape.
Well, so certainly sounds like you're very pleased with.
I am.
And you've been a patient of Dr. Mayberry's for many years, from what I understand.
I'd say about 7 years.
It's a long time.
Yes.
And you're very happy with good doctor.
Yes.
And to all the viewers who are out there watching, who are suffering from various dental problems, what would you tell them about your not only your experience with Dr. Mayberry, but Dr. Mayberry?
Well, have him look at your teeth and see what kind of problems you have.
There you go. And he'll take care of it for you, right?
That's right. He's a good man.
Yes, indeed. Now, on that note, I'd like to thank you, Ed, for joining us and being a guest.
Thank you.
Welcome, Ed.
Glad to be here.
We've got 2 Eds today. You're following the other Ed, huh?
Yep.
Now, listen, let me begin by asking you as well, what dental problems have you experienced over the years? How did they affect your life? And how did you come to Dr. Mayberry?
It was a situation where I had lost a lot of bone structure and then eventually lost a lot of teeth. And I was walking around, and when I smiled, I kind of put a hand over my mouth and everything. Yeah. Then the ability to eat certain foods and what have you. So eventually I made the decision that I've got to take some type of corrective action, and came to Dr. Mayberry and got multiple implants and it's been working wonderfully since.
Now, how long have you been a patient of Dr. Mayberry's, Ed?
I would venture to say about 2.5, 3 years.
Oh, okay. So these were problems you were experiencing prior to coming to him, affecting your life, not only your self-confidence, like you mentioned, but your basic functions of chewing and eating the foods that you've eaten most of your life, I'm sure.
Absolutely.
And so you came here, you had dental implants put in after you met with him, did the consult, and I'm sure he diagnosed what needed to be done correctly, and you had the implants, and you got all your confidence back. Are you a new you again, Ed?
Absolutely. And able to eat a lot more.
Well, that's wonderful, because I know what it's like if you can't eat what you want.
I know.
It doesn't make for a happy person, put it that way.
Right. And also the pain of chewing prior to the implants was a big factor also.
Oh.
And swelling and what have you.
Sure.
Because of the function of chewing and everything like that. And now I don't have any of that.
Well, I'm very happy to hear that. And for the viewers that are watching out there who are going through the same problems that you are going through, self-esteem issues, didn't feel comfortable smiling, affecting their chewing function and not being able to eat what they want, what would you tell them?
I would tell them definitely to explore the possibilities of implants and then go ahead and consult with your dentist to make sure that you're a good candidate for it. And then just throw caution to the wind and put your confidence in your dentist.
Yes, indeed, and get your life back again, right?
Absolutely.
Well, on that note, I'd like to thank you as well, Ed, for joining us and being a guest on our program. It was our pleasure having you on.
Thank you very much for having me.
Thank you. We're now back with Dr. Mayberry. Both Eds extremely happy. The results speak for themselves.
Yes, I'm very happy for them. We had a great result with both of our patients, and you know, it's very gratifying to me to be able to see them happy and healthy and able to have what they wanted out of their dental implant treatment.
Yeah, they got their lives back, their confidence back, their function back. The second Ed couldn't even eat certain foods until he came here, and you obviously corrected the problem with the dental implants.
It was very pleasing to me.
Now, I wanted to ask you, Dr. Mayberry, before I let you go, you and your practice here in Oakton, Virginia, have developed a reputation for excellence in the field of dentistry, and I wanted to ask you, what would you say separates you and your practice apart from so many of the other dentists in this area?
Well, I think the main aspect that separates our practice from others is that we do comprehensive dental implant treatment. We can do everything in our office. We can do the surgical phase of treatment. We can do the prosthetic phase of treatment. We place the implants. We let them heal. Then months later, when they've healed, we come back and we can rebuild teeth on top of those implants. We can make patients very comfortable. We're licensed to provide IV sedation, which is the very best in terms of sedation, very safe. We have a view to do everything that the patient needs in office and try and provide them everything without having to send them anywhere out of the office.
And you know, that sedation component that you offer here and provide for your patients if needed is very important as well. And that's a good point, because there's so many folks out there that have a fear of going to the dentist, and sedation dentistry is one way to alleviate that fear and remove it and have multiple treatments done by coming to a dentist like yourself.
Yes. It makes a big difference in people's lives. The other advantage we have is that we can provide any dental service that the patient needs. We're not going to limit ourselves to any one particular aspect of treatment. Patient needs a bridge, we can provide a bridge. We can provide crowns here in the office. We have CAD/CAM technology, we have digital x-ray technology, we have digital CT scans that help us plan our implant treatment from start to finish. We have a virtual plan, we can see where our implants are going to go. It takes all the guesswork out of the treatment, and it's exciting to me to be able to have that kind of technology in my practice.
Yes, Dr. Mayberry, you certainly, after we saw what you have here and heard about it and through our research, verified it, you're a state-of-the-art office as far as technology, and you're also a practice that really cares about its patients. We saw that from the two patients we interviewed today and others over the years, that you certainly have developed a very strong reputation. You and Suzanne, your practice manager, all of you here, really treat your patients like family, and it shows.
Well, you can have all the technology in the world, but it doesn't make any difference if you don't really help patients and show them that you care. And you know, I have to give a lot of the credit to my staff. They're wonderful, and they make people feel really comfortable when they come in. You know, it's a big step for a patient to come in to a strange office and they haven't been here before. And I've got to give all the credit in the world to my staff. They're great, and they make me look good.
Well, on that note, I'd like to thank you for helping us out and educating us with all this good information that you provided to better understand dental implants and their benefits. And on that note, again, thank you, Dr. Mayberry, for joining us and being a guest on our program.
Thank you very much. It's been my pleasure.
It was our pleasure. We'd love to have you back on in the future.
Thanks so much.